Hello! Having a newborn baby can be a really exciting and special time. There's lots to look forward to and so many new memories to be made. It's not uncommon, however, to have questions or concerns at some stage during your baby's first days, weeks or months. You know your baby better than anyone else, and so you will often know if something is wrong or just doesn't feel right with them. Babies can become ill very quickly, as they are so small and haven't yet developed a strong immune system to fight infection. Because of this, it's important to seek help sooner rather than later if you are worried. A common sign that your baby is unwell is if they become a lot hotter than usual, known as a fever. A fever is usually classified as having a temperature above 38 degrees centigrade. If you have a thermometer, you can measure your baby's temperature. If not, here are some signs that your baby has a fever. They feel sweaty or clammy. They have flushed-looking cheeks. They have a warm forehead, back or stomach, but cold hands and feet. You should seek urgent help from a doctor if your baby is less than 3 months old and has a temperature above 38 degrees, appears quiet and lethargic even when their temperature does come down, grunts with every breath or breathes faster than normal, looks pale or grey, is not interested in feeding, is not passing much urine in their nappy, has blood in their stools, has a high-pitched or weak cry. If you noticed they have a bulging fontanelle, which is a fullness in the soft part at the top of their head. You should dial 999 immediately if your baby stops breathing or turns blue, vomits green fluid, has a fit, has a rash that doesn't fade when you press down on it, has glazed eyes and doesn't focus on anything, or cannot be woken or is unresponsive. Cot death is a term that describes the sudden death of a baby whilst they sleep, where no cause can be found. Fortunately, cot death is uncommon, but more than 200 babies die unexpectedly every year. Here are some ways to reduce the risk of cot death. For the first 6 months, always put your baby to sleep in a separate cot, but in the same room as you. Always place your baby on their back when they sleep, on a firm, flat mattress. Don't cover their head or face whilst sleeping. Keep the room temperature between 16 and 20 degrees. Keep your baby away from smoky environments and don't fall asleep with your baby on the sofa or in bed. Research has shown that breastfeeding and vaccinating your baby further reduces the risk of cot death. For further advice on signs to look out for, please talk to your midwife, health visitor or GP. If you are worried that your baby could be unwell, seek medical help quickly.